I'm Monique. I'm going to be the nurse with you today. I am actually going to do a full head to toe assessment physical of you, okay? We're just going to start from the head and go all the way to the feet and work our way down, okay? If you have any questions at any time, just let me know. I'll just be making...
Is this like a yearly physical?
Yeah, pretty much. Okay. Yeah. I'm just going to make a couple notes, so don't get nervous when I do that, okay? Tell me your name and your birth date.
Daphne Tyson, 1/16/93.
Okay. Let me get my pen. Okay. So the first thing I'm going to do is kind of just look at you from your head. Start with your head. Looking to see if everything is kind of looking symmetric, atraumatic, no trauma that I'm seeing here. Everything looks really good. You were alert when I first walked in, spontaneous, asking questions, that's always good. Let's see. So I'm going to start with your eyes. I'm just going to have you look at me, and I'm going to turn this light on here. Just look straight at me, okay? This is just making sure that your eyes are reacting to this light and that your pupil sizes are equal. They look equal about 3 millimeters, okay? Looking at your eyelashes, everything looks very symmetrical. Now I am going to do 6-point gaze. I just want you to follow this light, okay? At this point, I guess we could just do a visual acuity as well. I would give you this. You would cover up one eye, and we're going to look at letters across the wall there. Read the top line for me.
Please not.
Okay. What is that? Can you read on the last line there?
Yeah.
Good. Now we're going to change. Close the other eye. Read that middle line.
When, door.
And the one right after.
Is.
Very good. I'm also just going to put some numbers down here. I just want you to follow my fingers and tell me what numbers I'm on, okay?
1, 2, 3, 4.
Yep, very good. Now I'm just going to work my way down to your nose area. Again, symmetric. Have you had any injuries to your nose? Any broken, any facial trauma before?
No, just a scar.
Okay, what's the scar from?
Got bit by a dog.
Okay. Okay, that one. Okay. So no broken nose, nothing like that. Have you been having any nasal congestion? Any pain?
Seasonal allergies. No.
Okay. So I'm just kind of looking at her nose, making sure that there's no drainage, no crust. Everything looks pretty good. I'm just gonna have you taking a good breath over here. Any problems with that? Okay. And everything feels very in place. Now I'm gonna make my way down to her mouth and her lips. They don't look dry to me. They're not cyanotic. They look very moist and pink, which is good. I'm going to have you open up your mouth for me. Okay. Very good. I'm going to look at your gums here. And I'm going to look at the inside of her cheek, which actually looks very moist. Her mucous membranes are intact. Everything looks pretty good. Teeth look good. There's not any missing teeth or a lot of cavities that I can notice off of just the gaze. I'm going to look at your ears now, okay? Actually, I'm going to get a tongue depressor and kind of play around with your gag reflexes, okay? This is just going to be a little uncomfortable at first. I'm just going to put this in the back of your tongue. The gag reflex. There we go. Listen, the gag reflex here. I'm going to have you stick your tongue out again. So everything is very midline. Push against this here. Very good. Now this one. Strong. No problems with that, which is very good. I'm going to move on to her ear. Oh, I'm just going to move over here first. Oh. Any problems with your ears? Any drainage coming from them? History of like ear infections?
No, I had tubes as a child.
Okay. Alright. Everything looks very good and translucent. No redness or swelling. No tenderness when I put that in there. Very good. Now, I'm going to just do her T&J here. Open up. There's no subluxation there. Very good. You can close it. I'm going to have you clench your teeth down really strong. You want to feel her muscles here, here, and here. Very good and very strong. Now I'm going to feel your sinuses and make sure that there's no tenderness with that, okay? So, any tenderness? What about here? Close your eyes for me. How about here? Then I can also feel for these, the temporal arteries here. Very good. I'm going to move down to her neck, inspecting it, making sure that everything is midline. Her sitting in this position, I cannot see jugular veins, which is very good. Now, if I were to lay her down a little bit more, I should be able to see that. Like I said, trachea is at midline. I would not just be able to feel her thyroid here, which I'm feeling here. I don't feel anything, no goiters, things like that, which is very good. I'm going to check your lymph nodes here. Any tenderness? Everything feels very good and in place. You feel for carotid artery. Very good. Bounding. And equal on the opposite side. All right, now I'm going to listen to her carotid. Very good. Family. I'm going to make a couple good notes here for you. Alright, we did. Okay, now we're going to do your chest, okay? Actually, I'm going to just have you move your chin to your neck here. Just want to make sure that there's no tenderness. No tenderness there. Ear to the side. This one to the side. Okay, and can you sit up just a bit so you can get your neck backward? How's that? No pain? Very good. Lay back here. Okay, now I'm going to do your chest area, okay? She would be in a gown at this point if we had a patient whose primary focus was on the chest or just for their annual. We would put them in a gown, but we won't do that for this video. I would make sure that everything is midline upon walking in, making sure she has a good rise and fall of her chest. No work of breathing that I'm noticing. Any asymmetric things that I could see, I would note, which there are none here. Everything looks pretty good. Any problems with breathing for you? Okay. Any heart problems that you know of? Okay. All right. So I am now going to listen. All right. Feel for the chest. Let's listen first for the valve. Actually, I'm just going to feel here if there's any air pockets or any tenderness. No. And we would also do like a breast exam as well while we're in this region, making sure we're going from one side to the other clockwise. Do you do that annually?
Yes.
Okay. And in the shower? Okay. Very good. And we also go into that axillary part just to make sure that there's no bumps or lumps, things like that are kind of not normal for you. So, which I would do here also, which I don't feel anything, no tenderness at all. Very good. Well, this is where we would ask also for history, you know, mothers, grandmothers, anybody in your family that may have breast cancer. Okay. So now, after palpating and all that, I'm going to listen to the anterior chest. Good deep breath. In. Let it go. In. Good. In. Good. The right side has 3 lobes, so I'm going to listen to the corner. Good deep breath. All Phone sounds are very clear. Do you smoke?
No.
Have you ever smoked?
No.
Okay, good. Now I'm going to listen to your heart. Okay. I'm going to listen to these valves. Aortic, pulmonic first, with the bell of my stethoscope. Finishing with the mitral valve, which is the maximal point of impulse. And that's at the mid-clavicular fifth intercostal here. Everything sounds really good. I'm going to have you kind of sit to the side here while I try to listen. Have you ever had a murmur or anything?
No.
I'll just do it over here. And we're just getting the good love dub here. I'm going to get the back of you if you want to sit up here. So also, kind of doing the same thing here, we would do the same thing in the back, the posterior chest wall, making sure that it's symmetric. We can also assess the spine here, just so we can kind of save some time. Everything looks pretty good, straight. No problems with your back, any back pain at all. Okay, so I'm going to listen. Big deep breath. Big deep breath. And this is where we would do percussion, so I'm going to have you kind of swing your legs forward. So we'll be percussing here, starting from the top. Until we get to that dull sound, where we would measure where that dull is. Go down, measure where that dull is there, and we do that on both sides, measuring the diaphragmatic excursion here. I'm also going to do some tactile firmness here. I'm going to have you say 99 for me. 99. Where we can feel the thrills on our hand, which is good. And also something I forgot with the chest is also that you want to place your hand here feeling any thrills or pulsations, which I can't feel just off palpation here in this area. Okay. Let me write some notes on that. Everything looks pretty good with your skin. Pink, warm, and dry, like I said. Warm to the touch. Cat refills look good. Good circulation here. No axillary muscle use that I'm seeing when we did our inspection there. No deformities. Okay, we did the heart. Okay, now we're going to move on to your belly, okay? We'll have you lay down. Alright, so we're going to look here. Alright, so first I'm just kind of inspecting here, making sure that abdomen is symmetric, there's no bulges, there's no one side bigger than the other, kind of assessing up here as well where our liver lives. There's no real protrusion that I'm seeing one side versus the other. I've noticed the belly ring here, kind of seeing if there's any infection or anything, which looks pretty good. Well kept assessing for her color, pink, warm, and dry, moist, good circulation. Now I'm going to listen before I feel around. See, I'm hungry. Have been having normal bowel movements, normal urine, things like that? Okay. Now I'm going to listen to this artery that lives right up here with the bell of my stethoscope. The femoral. I'll also do that here. Very good. Okay, so I'm just going to percuss here, okay? And then also percuss the liver here. And you would kind of, if they have larger breasts, you can move that up. Percuss down. Percuss where the liver might end, which would be about here, which I'm hearing. And then we would also do the same side to the other for the spleen here. Feel here. Nothing really bulging or anything that I can feel. Tenderness there.
Yeah.
Okay, and now I'm going to lightly touch around. Any tenderness? Okay, now I'm going to kind of go in a little bit deeper, okay? Is that hurting you?
No.
About there. There.
No.
Any vaginal discharge or bleeding noted? Other than, you know, obviously you're in your period.
No, that's it.
Okay, now I'm going to have you sit up. Any tenderness here in the back?
No.
Didn't hurt at all? Okay, you said everything with your urine has been fine, right?
Right.
Okay, now I'm going to have you kind of scoot this way. We're going to look at your arms and your legs.
Scoot which way?
Switch your legs outward. Okay, so we're going to assess your arms here, your extremities. And first I'm going to start with your hands, okay? Just kind of looking at them. If there are any obvious deformities, which I don't see here, after looking at them, any tenderness, no swelling that I feel, no redness, and no tenderness here. I'm going to do that for both. Okay, and then I'm going to look for capillary feeling all over fingers here. Everything looks good, coming back within 3 seconds, which is a normal finding for her. I'm going to check your pulse. Okay, I'm going to check the pulse on this side. They're both equal and bounding. She's pink, warm, and dry. No edema that I'm noticing here. No edema here in the upper arms. Go ahead and abduct this way with your fingers. Bring them back together, which is abduction. And thumb opposite. Let's see. Can you move your thumb around a little bit? What about you? Awesome. Good. Let's see. Squeeze both my fingers here. Very good. You're strong. Now we're going to do our wrists. Any tenderness here?
No.
Any tenderness? No obvious deformities, obviously. That's before I palpate it. No tenderness, which is very good. No crepitus noted. No nodules noted. And both of them look really symmetric. And just have you kind of rotate your wrist around for me. Good. Can you put it back up? Extend it. Very good. No pain or tenderness, right? Alright. Now we're going to do, we're going to feel for your elbows. We're going to do the same thing, kind of looking, making sure it's symmetric. No nodules noted, no redness that I can see, no warmth to the touch. Feeling here, no nodules, no crepitus, like that. Good. So we're gonna have you supination here, up, down, and inward. Very good. And that doesn't hurt at all, right? On either side. Very good. All right. And now we are going to place your hands on mine. Push hard against my hands all the way through. Any pain?
No.
Now right here. And me on you, okay? Try to resist me. Very good. Okay. Now I'm gonna put your arms down like this. Try to hold against mine. Very good. Let's see. Okay, we're gonna check your shoulders here. Any tenderness or anything like that with your shoulders?
No.
Any pain when I touch you?
No.
Everything looks very symmetric. I don't see a drop or anything on one side versus the other. I would also assess the clavicle here, starting from this part, working my way up to the acromion, or to the coracoid process here, and then the acromion here, and then that joint right in the middle of that. Any pain?
No.
Okay. Now I'm going to have you abduct your shoulder here, away from you, adduct inward, bring it back. Is there pain?
No.
Okay. Ooh, bring it forward. Pain?
No.
Good. Let's see. Hold on with this. Bring it on with this. Any pain there?
No.
Now we're going to do our deep tendon reflexes here in the upper part of your body, okay? You can feel me touching you here, right?
Yes.
And your fingers, you can feel me touching that?
Yes.
Okay. You're going to get, look for your deep tendon reflexes, okay? First I'm going to start with the radial. Very good. I'm going to get the bicep from here as well. Very good. And I'm going to get the tricep here. Very good. All intact. Let's see. So I'm going to have you go like this with your fingers and press against each other. Does that hurt at all?
No.
You want to kind of praying hands like this? Very good. Or you can do it this way also. No pain?
No.
Good. Alright, now we're going to look at your lower extremities here. Making sure everything is symmetric. Not one doesn't look big versus the other. Is there any tenderness or anything when you're walking? Any pain when you're running, working out,
No.
things like that? Okay. Everything looks pretty good. I'm not noticing any like varicose veins, things like that on your legs. Now I'm just gonna kind of feel all over any pain.
No.
Everything looks pretty pink, warm, and dry. No edema noticed here. Can you feel me touching you when I'm moving everywhere?
Yes.
Very good. Cap refills in the toes. Less than 3 seconds on each toe. Very good. I'm going to check for artibial pulses, arpedal pulses on both. They're all equal on each side. Check the popliteal and the femoral also. Intact. Pink one again, like I said, no edema. I'm going to check the ankles now. If there's any tenderness or soreness, warm, touch, nodules, things like that, I don't see that initially. And when I feel it, everything feels pretty good. Are you having any pain with your ankles? Do you have a history of like spraining your ankles?
Yes.
Okay.
Sprained it.
Okay. How long ago?
I've sprained it like 5 times. So.
Okay. Do you still have pain from it?
Yes.
Okay. Does it hurt when I'm touching you here?
No.
Okay. Now I'm gonna put your toes toward the floor. Is that hurting you?
No.
Now point them to the ceiling. Very good. Now I'm gonna have you push on my hands as hard as you can. Pain?
No.
Toward you. Pain?
No.
Very good. Now I am going to assess your knees. So, symmetry, I see a scar here. What happened?
Softball.
Okay. Sliding and all that good stuff?
Yes.
Okay. Feeling on the knees. There's no nodules, no pain. You've never had any knee surgery or anything like that? Okay. Everything feels pretty good. No swelling, no deformities, nothing like that. I am going to kind of flex you. Does that hurt?
No.
We're going to push it back. Does that hurt?
No.
Okay. And then we're going to go ahead and just try to relax your leg here. Does that hurt at all when I'm moving it? Very good. Now I am going to lay you down and assess your hips. Alright, so I'm just going to assess your hips here. Making sure that it's stable. Does that hurt at all?
No.
Okay. Now I'm going to have you, I know you're just getting warm. Get your hips here and I'm going to have you kind of turn to your side here. Is that hurting you at all? No. Okay. Now we're going to go pull your leg away from your body. Okay. Now toward. Now bring your foot back, your leg back. Does that hurt at all? No. Okay. Now we're going to do the other side. Now away from your body. Abduct it. Adduct. Does that hurt?
No.
And then backward. Does that hurt?
No.
Okay. Alright. Now I'm going into your have you sit on the side of the bed again. Sorry. I'm going to check your knee reflexes here. And now I'm going to check her Achilles reflex here. Alright. Now I'm going to see your any of your rapid movements that you may have. So I'm going to have you get your heel here and rub it all the way down this leg here. Good. Now the opposite. Very good. I'm going to have you stand up so I can check your back. There's no, like, when she walks, there's no popping out or anything like that at her hips either. Stable. Okay, I'm going to have you bend forward. I'm going to check here. Everything is very symmetric. Straight down. I don't feel anything kind of bulging out, anything like that. Any tenderness back here? No. Okay. Very good. Now I am going to have you stand up. Try to bring it back as much as you can. Go to the right. Any pain? No. Left? No. Do the Tootsie Roll. Just kidding. So that's all very good. I didn't see anything that can be indicative of a scoliosis. Now I'm going to kind of turn you around and just walk from that table toward me just so I can just, very good. Gait's very appropriate for age. Can you hop and place in one foot for me?
Yeah.
Okay, hop. Good. Now the other one. Very good. All right, and I believe that is all.